This is Neily on Nutrition. I'm with Todd Whitthorne. He's an executive at the Cooper Aerobic Center in Dallas. And we're talking about vitamin D. We just talked about how you know if you're low, physician's test, and our blood test. And what if you're low? So what's the big deal? Why are we so concerned about it?
Well, when you're low, all the research will indicate that you are at greater risk for a number of health problems.
Okay.
We learned about vitamin D originally with its relationship with rickets, which was, children's bones would not calcify because vitamin D helps regulate the uptake of calcium into the bones. So if you don't have any vitamin D, the calcium's not going to get in there. Right. So we've known that for a long time. But starting in the 80s, we started learning about the relationship of low vitamin D status and risk of cancer. Colon cancer, breast, prostate, ovarian. There's 17 different types of cancer that are associated with low vitamin D status. Cedric Garland, Dr. Garland and his group out at UC San Diego has done a lot of that research, especially with colon cancer and breast cancer. So that's a reason. You look at immunity. This is one that I think is fascinating. Those with the lowest levels of vitamin D are 36% more likely to suffer from colds and flu and upper respiratory tract infection. So if you get sick a lot, it may have something to do with your vitamin D status. But we know it's related to chronic pain because vitamin D is anti-inflammatory. If you've got joint issues and you're just kind of achy all the time, it's related now to depression and cognitive issues. So again, we have receptor sites all over the body. We've been making it for a long, long time, a couple million years. The problem is that we live inside, we work inside, and if we go outside, we wear sunscreen, which is not a bad idea. No one wants to increase your risk of skin cancer, but you don't want to throw the baby out with the bathwater. And a sunscreen with an SPF of 15 or greater, and I don't think anybody wears 15 anymore, it's always 50 or 100, that will block 99% of vitamin D synthesis.
Oh, gosh.
So if you're wearing sunscreen, you're not making any vitamin D. You may be lowering your risk of skin cancer, which is terrific, but you, again, don't want to throw the baby out with the bathwater. You've got to be proactive with your health and figure out where your D level is, and whether it be through the sun or through supplements. Supplements are easy and very inexpensive. Just make sure you take care of yourself.
Yeah. In regard to that, Todd, okay, so I hear a lot from my clients also. I'm out in the sun plenty. I live in Texas. I'm sure my vitamin D is fine.
Right. So
answer that, please.
A couple hundred years ago, there was this Scottish philosopher. His name was David Hume, and he used to say that a wise man proportions his belief to the evidence. So the evidence is, get your blood tested.
Okay.
If it's above 30, ideally if it's 40 or 50 or 60, great. You're getting plenty of sun. You're good. If you're a lifeguard in La Jolla, California, you probably have a pretty good natural vitamin D level. Or if you're a mailman and you're delivering, you're outside all the time, probably you do. But all the data indicates that even if you sail a lot or you ride your bike a lot and you're outside a lot, in fact, we did a study back in 2009. I was curious about runners. I'm involved with the Dallas Marathon, and I thought, well, runners are outside a lot. I wonder if they have higher vitamin D levels than normal. We looked at 36, just an observational study. We looked at 36 men and women that were averaging at least 20 miles a week of running, and 75% of them had vitamin D levels below 40, which is kind of the cut point at the Cooper Clinic where we want people to be. So even if you're an athlete, a triathlete, a runner, or whatever, the odds are you're going to be low. And we also know that skeletal muscle has 2 vitamin D receptor sites. So if you're an athlete, you want to make sure especially that you've got your vitamin D where it should be.
Okay. Thanks for watching Neily on Nutrition, and we'll see you in the next video.